Hi, everybody. This is Jeff Delto of Convergence Training. This is a part of the Convergence Training webcast series we've been doing on issues related to safety training and safety training. And we've got a special guest today, one who's been with us in the past. It's Pam Walaski of GAI Consultants. So first tip, if you have not heard the earlier podcast or webcast in which Pam is talking about moving from a compliance-based safety systems to systems that incorporate systems thinking, risk thinking, and safety management, you should definitely check that out. And we'll include a link to get you there from here. But today, she's going to be giving a really practical tips about how to put that all into, how to implement that at work. I think she's going to give us 5 tips about how to start this up. So with that, let me say hello and welcome to Pam, and of course, hi to everybody out there. And Pam, how are you doing today?
I'm great, Jeff. How are you?
I am well, thank you. Thanks again for coming on board and talking with us about this. And we're excited. We had a lot of great reaction the first time around, so we're excited that you're going to give us some practical tips. Before we get into that, could you maybe, for people who are new to this little webcast series or new to you, could you tell us who you are and what you do and why we should find your thoughts on this issue interesting?
Thanks. So as you mentioned, I work for an engineering firm called GAI Consultants. So we do environmental, energy-based engineering infrastructure work. We're based in Pittsburgh, Pennsylvania, which is where I'm sitting right now at our headquarters office. But we have about 20 offices throughout the primarily eastern part of the United States, from Green Bay, Wisconsin to Palm Beach Gardens, Florida. We have lots of engineers. We have a lot of field staff who are out doing wetlands delineations and species habitation surveys and monitoring construction of roads and bridges. And also we do a lot of support for a number of other energy clients. I'm the health and safety director here, so my responsibility is our staff. About 1,000 of them, as I said, and anywhere from 300 to 400 of them are out in the field every day, and those are the ones that I primarily pay attention to. I've been in occupational health and safety for about 25 years now, and had a variety of different positions with a variety of different companies. Primarily, as I've worked over the years, I've gone from sort of the standard kind of health and safety commodity work to a little bit more systems thinking and risk management work. I'm also fairly active involved with the American Society of Safety Professionals, which is the big group that has most of the occupational safety and health folks involved. I'm currently serving a 3-year term as an at-large member of the board of directors, and that just started in July, so that's very exciting. I get to participate in sort of helping to shape and form some of the organizational activities for the next couple of years. So that's me.
Hey, that's great. I didn't know that about the board of directors. Congratulations.
Yeah, thank you. It's a very exciting time for the organization, and I'm really looking forward to the next 3 years.
Well, speaking of the ASSP, just to toot your horn one last time before we get into the questions, Pam frequently writes for the ASSP's magazine, Professional Safety. It's where I first came across Pam, a really excellent article on issues related to today's conversation, and also speaks at a lot of ASSP conferences and other things. So look for Pam in safety journals and look for Pam at safety conferences, and that will be worth your time. All right, so let's get right in. Pam, if this whole webinar cast is about moving away from compliance-based safety and moving towards risk-based safety, could you maybe just tell us what you mean by those two terms and why one would move from compliance to risk-based?
Sure. So just to sort of recap that conversation that we had before, the compliance-based focus is really where we take a regulation and we read what it says that we're supposed to do, and then we do it. And so it's kind of a line-by-line, regulation-by-regulation approach to developing workplace health and safety programs. For most of us, it's OSHA. Some of us also have responsibilities for environmental things, so we're paying attention to EPA. Some of us have responsibility for transportation, so we may be aware of what DOT says, those kinds of things. Risk-based approaches are approaches that focus our energy on the risk of the tasks that we do and a constant and continuous drive to reduce the risk of our tasks to the lowest, most acceptable level to our organization. When we rely on compliance regulations, we end up in a couple of different problem situations. The first one is, as you know, regulations don't change very quickly. And so when new and different thinking comes on the horizon, those regulations don't often catch up with it. So if we rely only on them to base our programs, we're not really looking at newer thinking. The second problem, I think, is that compliance is really only ever been intended to be the ground floor, the basics. And so if you're complying with what the regulations say, that's not really saying much about your organization. And then the third one is that notion of a regulation being a standalone requirement. There's no system basis to it. You may have a confined space entry program or a PPE program or a fall protection program. But when you have tasks that involve confined space and heights and PPE at the same time, you now have 3 different documents that you have to kind of manipulate to work for that particular task. So the important thing about systems-based or risk-based is that it's designed to work together and that everything kind of smoothly and seamlessly overlaps and moves back and forth. So that's kind of what we're talking about when we talk about risk-based or management system-based types of approaches to workplace safety.
Great. And before we move forward, just to, in case anybody out there has any red warning lights flashing over their head at this point, picking up stuff I've read you write in the past, you're not arguing to ignore compliance. And I think what you're saying is, compliance will come as a side effect of the safety management. Is that correct?
Sure. So if you think about fall protection and you sort of try to review and think about what OSHA says you should do with fall protection, if you're doing a risk-based approach, you're going to be working on getting workers working at the lowest possible level, or designing out systems where they don't have to work at heights at all. And if they have to work at heights, you're going to make sure that they're wearing the proper systems and everything works together. So as you say, doing sort of a risk-based and a systems-based approach ends up complying with most regulatory frameworks anyway, except for the things that may not have to do with the risk. When we talk about posting the OSHA poster and the record-keeping standard, those kinds of things may not be as tied directly to risk, but still need to be done.
All right, good addition. All right, so you've been kind enough to come in here and give us a little 5 or 6 step roadmap for actually implementing risk-based systems and safety management systems at work. And I wonder if before you dig into each of those steps and tell us those in detail, if you can kind of just give us a bird's eye view and the roadmap of that process.
The process of moving from one system to the other is what you're asking about, right?
Yeah.
So sometimes that feels very overwhelming when you sit down and you think about where you might be now in your organization versus where you think some other organizations are who have got it, who are doing this now. You look at that gap between the two and you think it's insurmountable. But if you think about that adage about how do you eat an elephant, that's usually the way I try to get people to think about it. You eat an elephant one bite at a time. And while it may be overwhelming and impossible to eat an elephant, any major initiative or project or eating an elephant can be broken down into manageable pieces or bites. And once you start to do that, you can find that path forward. It's like any other large project when you begin to break it out into individual tasks and create a plan for yourself. That's how you get to that point. Each step may not be consequential. And at first, they're baby steps and little things, but you get closer and closer and closer. And at the same time, as you begin to do that, I think you begin to create a momentum that kind of gets you to the place where you're ready to turn that ship in a different direction. And so that's the way I like to think about making these kinds of changes. The first bigger overarching change that I think we have to make has to do with the paradigms, some of the paradigms, most in particular the one that told us that if we reduced frequency of incidents, we would reduce the severity of them as well. And we know now from data and from looking at incident reviews and other kinds of data that's out there that really isn't true. We know that there's a percentage of all incidents that have the potential to be a severe incident, a serious injury, a fatality, or other major property damage or whatever factor you might want to think about. And so we need to sort of rethink that and come up with a different way to approach it. And a risk-based approach allows you to begin to look at severity first rather than frequency, by focusing on the higher risk tasks first. One way to do that is to look at those kinds of precursor situations and causes that are unique to your organization. Every organization has them. You need to figure out what they are. We need to get ourselves away from chasing those trivial kinds of situations, elevating the trivial near misses, where we spend hours and hours of time looking at all of our near miss reports and trying to investigate each and every single one of them. We need to really look at those near miss reports and say, which one of these had the potential to cause a serious injury or fatality? And that's the ones that we want to focus our time on and shift ourselves to those types of incidents, to those types of tasks and hazard assessments. And again, it's going to be unique to your organization. We'll talk some more as we go through our time together about how to begin to make that shift and identify those. But like the OSHA parallel that we were just talking about, we're not talking about ignoring minor injuries or first aid cases. We're not saying we don't care if somebody has a minor recordable or has a minor injury that doesn't result in lost time. But we have to start somewhere. And so back to the elephant analogy, we can't keep doing the things that we've been doing. So we need to start in a different place. And similarly, I think when we begin to really attack the kind of situations that have the potential to cause a SIF, serious injury and fatality, or an FSI, fatality or serious injury, whatever acronym you choose to use, we can then turn our attention to less serious incidents. And in the same time, I think the cascade effect of the risk-based approach will also have a natural outcome of reducing those other kinds of non-serious injuries and first aid cases as well.
Okay. All right. So that's a nice way to look at a couple things. The one to kind of move from maybe something that people know as Heinrich's pyramid or Heinrich's safety pyramid, and this kind of focus on all minor issues in the hope that that'll prevent serious issues, and then kind of a step towards starting to use risk-based approaches as well. I've seen you write about kind of a 5-step process that involves becoming the expert, stop saying OSHA says, adopting a leading metric, taking a deep dive into data, and finding a few risk champions. Would that be a good thing to break out at this point?
Yeah, I think it's helpful for people to, again, what are those baby steps and what are some of the things that you can begin to do? So if you have nothing at all, where do you start? And these, I think, are 5 things that anybody, regardless of your understanding and knowledge and expertise about risk and safety management systems, these are easy things that you can begin to do right now with limited time and limited resources while you begin to start to eat that elephant.
All right. So tell us more in detail then about, I guess, step 1, if you will, becoming the expert.
Right. If your familiarity is with OSHA regulations, you may be a real expert in them. You can spout off the number and the citation and all those wonderful things that are in there. So what I'm asking you to do is the same thing with the various consensus standards, those voluntary consensus standards that are out there, and become that kind of expert on them. Unfortunately, they're not available like the OSHA standards are by going to osha.gov. You have to buy them. They're available for purchase. ASSP obviously is one organization that sells them, but other organizations do as well, some of them depending upon who published them. So you got to buy them. You got to buy them and you got to read them. And not just the standard itself, because I think once you start to get familiar with them, you'll see that the standards are very, they're not prescriptive at all. They're not going to tell you exactly how to do everything. They're going to give you an end point and say, this is where you need to be. So the standard itself is a pretty brief part of the document. It may only take a couple of pages to talk about one particular aspect of the standard. But each one of them has addenda at the end of the standard. that is designed to give you guidance or explore a particular issue. They may provide you with resources like a risk management report format or a management of change policy. And those are all samples that you can just simply take and adopt or manipulate to meet your organization's needs. They have commentaries that allow you to explore the sections and resources like books and websites and articles and other kinds of things. So once you think about the individual standard as kind of like the hub, the spokes off of that standard are all kinds of different things that you can begin to take a look at as you begin to deepen your understanding about one particular standard or one particular issue. It may take you a while, but you just got to jump right in there with both feet and just kind of start getting yourself really deep into those and just begin to look around. And then, your natural curiosity is going to start to take you other places as well. I would take a minute to remind everybody of those standards, if that makes sense to you as well, Jeff.
Please, that's exactly what I was going to ask. Yeah.
Yeah, I figured. So we talked about some of them. The biggest one when we talk about risk management is the Z690 series of standards, which is the ASSP ANSI version of them. There is the ISO version of them as well, and there's 3 of them. That's Z690.1, which is also ISO Guide 73, and that's the vocabulary for risk management. Z690.2, the ISO version is ISO 31000, and that's the principles and guidelines behind risk management. And then the third one is Z690.3 or ISO 31010, which is the techniques, and that's the description of the different risk tools that are available to you. In addition to that, and built into the safety management piece would be either ANSI ASSP Z10, which is the North American version of an Occupational Safety and Health Management System standard, or the recently published ISO 45001, which is more geared towards organizations who want to have a global type of a standard or may want to be certified through ISO for their safety management system. And then last but not least is Z590.3, which is prevention through design. And the importance of that particular standard is that if you're really serious about reducing the risk of your organization's tasks and activities, you're going to have to focus on higher level controls, which means getting away from PPE and training and administrative practices. And prevention through design really gives you a roadmap for how to get to that process. So that's a good one to tuck into your back pocket as well.
Great, thanks. That's a good list. So we got Z690 for risk, Z10 or ISO 45001 for safety management, Z590.3 for prevention through design. And I really liked that you mentioned the appendices or the annexes of these standards. I'm working on a standard myself, and by far, right now, Z490.2 and online safety training, by far my favorite part are the annexes, and that was true with Z10. I thought Z10's annexes were really helpful. And I think the other thing I'd remind people out there is you should get these standards for sure. You should read them, but there are other places to learn as well, including people like Pam. And Pam, I am sure that you could tell me if I'm right or wrong that places like the ASSP offer continuing education on things like risk as well. Is that true?
Sure. ASSP offers actually certificates in risk assessment and a certificate in ISO 45001. They offer global training certificates and a whole variety of different resources if you want to deepen your expertise and your resume, if you will, on those kinds of things. I also mentioned, I spend a fair amount of time on LinkedIn. I know a lot of people have developed profiles and never gone back again because they just, feel like it's not the greatest place in the world. But, if you're very targeted about who you follow and what you do, I think there's some really good resources there. For example, I follow a group called ISO 31000 Risk Management Standard. And that group is a very, very busy group. There are threads that are being added to every day. There are new things that are being posted every day. There's a lot of good things on there. There's another good group on there called Safety Differently, which I think you're familiar with as well. It focuses on some of the work that Sidney Decker started years and years ago. It's great because a lot of the posts on there and the articles on there and the discussions on there really get you to think about safety differently. And to me, that just begins to broaden your thinking processes and your approaches, and really gets you, chewing on some of that new and different stuff. I also like to pay attention to some people like Ron Gant, who I know you know. There's a Dutch gentleman by the name of Karsten Bush who writes some really interesting things. Todd Conklin is a great guy to really get you thinking and wondering if maybe you really need to rethink your philosophy, and he really gives you some good, clear understanding of that. And I also follow an organization called the Krause Bell Group, which is Tom Krause's consulting group. He partnered up with Kristen Bell, and they do some interesting content as well. So LinkedIn can be a really good resource if you pay attention to certain people and if you pay attention to certain groups. It can give you a lot of really good information. And the last thing that I always tell people is, when you go to conferences, speakers are more than happy generally at the end of their session to chat with you. Seek them out, ask them a question, share a business card, connect after the event, so that you can begin to sort of develop that network of people who have thinking around risk and safety management, so that you can build on that. Those are great people to go to when you have a question, or when you want to explore something in a little greater detail. That's what you need to begin to build. So become the expert of the stuff on paper, but also get to know the experts, the people experts, and get to know them a little bit. I think it's a very important piece of the process.
Good call. And for anyone listening, we just heard all these names. I will transcribe all this, and I will provide links to Todd Conklin's pre-accident investigation podcast series, for example, and to Ron Gant's safetydifferently.com site. So just follow those links. Another thing I'd call out, there's a nice LinkedIn group on ISO 45001 put together by Chris Ward, who helped create that standard as well. Okay. So if that's how to become the expert, both on your own and using the expert community at large, what can you tell us about tip 2? Stop saying OSHA says.
I think tip 2 is about pivoting and remembering and retraining ourselves to answer questions differently. If a staff person who is running a CNC machine comes up to you about a particular hazard that he or she is concerned about, or a senior leader, nabs you walking down the hall and wants to discuss a particular recommendation that you're making about spending some money to improve the organizational workplace safety program, we have to pivot away from OSHA regulations. We can't run to the online standards, because every time we answer that way, we perpetuate the notion that that's where the answers are. And we have to sort of retrain our workforce and the people that we work with to think differently. And so when those kinds of questions come up, we have to be prepared to talk to our workers and our senior leadership and our middle leadership from a risk-based approach. We begin to talk about how to answer a question about a hazard on a machine by looking at the risk and focusing on those factors of probability and severity, and helping that worker begin to address it from that perspective. Eventually, obviously, the goal is to have that worker learn how to apply those kinds of concepts on their own. So the next time they're faced with a hazard, they begin to think about a risk-based way of approaching it rather than what OSHA says about it. Same thing about management. When you talk to them about things, when you talk about needing to spend $500,000 because OSHA says, you see their face just sort of glaze over. But when you begin to talk to them about the return of risk reduction that particular expense will provide and how it will get your organization to those kinds of things, they can better understand the recommendation. I have a whiteboard here in my office, and one of the things that it says on that whiteboard is occupational safety and health risk management is business risk management. And I think it's really helpful to remember that, because that's what our organization is doing. Their risk management approach that they're taking is no different than the risk management approach we should be taking for occupational safety and health.
And I've read you speaking about that last point, and essentially I think what you're saying is that safety currently speaks kind of a different language than the rest of the business organization. And if safety starts adopting risk management procedures and talking risk, they will align themselves with the rest of the organization. Is that correct?
Yeah, absolutely. Absolutely. It's already happening. And again, we want that seat at the table. We want to be part of the C-suite. We want to be accepted, all those kinds of things. The business case for safety, all those phrases that we've been talking about for years. I think we have a better shot at getting to those objectives by talking risk, because that's the way our organizations run, whether it's financial risk or supply chain risk or enterprise risk management. Um, we're part of that. And that gets us where we need to be with our organizations.
All right, great. Tip 2 was stop saying OSHA says. Tip 3 or step 3 is identifying and promoting one new high impact leading metric this year. And I wonder if you could start that discussion by telling us the difference between a lagging indicator and a leading indicator, and maybe giving us an example of a leading indicator.
Sure. Sure. Lagging indicators are the ones that we are familiar with. They typically center around incidents and rates associated with incidents. So we might have a total recordable incident rate, or a days away restricted and transfer, a DART rate, or a lost time rate, or a severity rate. Those are the kinds of lagging indicators that are most commonly used to demonstrate that we're doing well or not doing well. Sometimes you also look at things like the number of completed inspections. Well, we completed 25 inspections this month out of the 25 that we had to do, and isn't that wonderful? Or we got 762 near miss reports this quarter, and our goal was 750, and isn't that wonderful? Again, those are things that have already happened. They tell us how somebody has gotten hurt, but sometimes they just tell us how lucky we were. Inspections tell us about the hazards that were there at one specific point in time. It doesn't tell us anything about how well our fire protection system is working. It doesn't tell us anything about how well the systems that we're focusing on are working. Doesn't mean we shouldn't be doing them, but again, they're not getting us to that system-based, risk-based approach. Leading indicators tend to look at proactive initiatives, proactive activities, proactive kinds of things that we're doing. And so it allows us to spend our time on moving the organization into a proactive focus rather than a reactive focus. So some of the things that organizations might look at is not just how many near misses we got, but what we did with those near misses and how they were triaged and what kind of corrective actions came out of those near misses. We may not look at just inspections, but we might begin to track how many different types of findings we found with those particular inspections and what we're doing with those findings, or how many corrective actions were closed in a time frame that we identified. So we have an inspection that finds five things that need to be corrected, and they were all supposed to be done within 30 days. And we track that data to find that, yes, they were all done within 30 days. Perhaps we're looking at how many preventative maintenance tasks were completed on time. Or maybe some organizations might look at the reduction in the use of PPE. That tells us that we're starting to use higher level controls to reduce the risk. If we had 100 people who were using respirators in 2017, and our goal is to get to 40 people in the end of 2018, we can track that kind of progress. So those are leading indicators. And those are the kinds of things that I think we need to get our organization to be more focused on. The problem, of course, is that we've told everybody for many, many years that leading indicators are very, very important. We've told them that they are an indication of how safe our workplace is. And so now if we want to go back to our senior leaders and say, you know what, they really aren't. They're not what we told them they were. Again, you're going to get that face that we were just talking about a few minutes ago. So I like to think about weaning our organization off of lagging indicators and moving them more towards paying attention to leading indicators. And like the elephant, you can't do that all at once. But if you can say in the next 6 months or 3 months, find one leading indicator that you think is really impactful for your organization, figure out a way to create it, to track it, and then begin to promote that over the next 3, 6, or even 12 months. Everywhere you can, talk about it. If you have an intranet, make sure it's up there. All of your safety messages and meetings, it should be incorporated in there. People should be able to have a real good line of sight on that particular indicator. so that they begin to think about it and know it, just like they know what your TRIR was, just like they can tell you how long it's been since you had a recordable. At the same time, I'm not saying to pull the lagging indicator out from under everybody. You can certainly leave it up there. Just downplay it a little bit more. Don't focus on it so much. Somebody asks you about it, answer the question, but don't offer it. As your leading indicator gets more traction, then you can begin to find another one and then another one. And so you very slowly begin to move your organization to focus on leading indicators and not lagging ones. There's another adage out there about what gets measured gets done. And if you're measuring lagging indicators, that's what people are going to focus on. If you're measuring leading indicators, then that's what people are going to focus on. I'm not suggesting we get rid of lagging indicators completely. My organization, for example, our clients pay very close attention to those right now. They're benchmarks that they use to determine whether we can continue to work with them or whether we can respond to RFPs. So we do have to pay attention to them, because for our organization, not doing well is a business risk. But there's a balance out there, and so perhaps you want to have both indicators at the very least and work your organization into that. And that may take you a couple of years, but you can certainly get started with one of them in the next 6 months.
And I wonder if you have any guidance for a company who wants to make that first step and start tracking one leading indicator. Maybe one or a couple you might suggest, or is it just such an individual case-by-case basis? Everyone would have to make that call on their own?
It is an individual one. I think a lot of organizations do near-miss reporting in some way, shape, or form. And so one suggestion I would have is, if you're doing that, instead of just establishing some sort of a quota that you're trying to achieve, focus a little bit more on the content of those near misses. And going back to that severity potential, finding those near misses and finding a way to triage those near misses and elevate those ones that have the potential for a serious injury. And then take a look at what comes out of that near miss. We decide we're going to do A, B, and C. And then the thing that you want to track or promote is, how quickly do we correct A, B, and C? Maybe you have an expectation that you meet 50% of the corrective actions get closed out within the time frame that's identified. And that's your first start at a leading indicator. That tells you that you're moving the organization forward and not backward. So that's one example that I think is common to a lot of organizations. So that would be one that I would suggest you could start to look at.
Great. And this is not a prepared question, so if you don't have a snappy answer, feel free to say, that's very interesting, Jeff, but let's move on. But I think it's important for organizations to learn, and one of the best ways to learn is from mistakes and failures, and communicating about those. And you can see there's an opportunity for that kind of thing in safety when you tell management, or when you tell all the organization employees, we've been focusing on lagging indicators, and we really should not have focused on that exclusively, or we should have been focusing a little more on leading indicators. I wonder if you have any thoughts about the difficulty of kind of owning up to that, or any stories you might be able to share of people actually doing that and having it go well.
I think it's fair for safety professionals to say to their organizations or their leadership, look, we're evolving as a profession. We may have thought that this was important, but as we've begun to take a closer look in the past 10 years, we've realized that while that might have been helpful before, and it's not helping us now. And if you understand the issue well enough, if you've done your research, if you've done your reading, you can make a very good case for why you need to make that switch to your organization. I don't think it does us any good to just pretend that we weren't doing it all those years. I think it's very important for us to own up to it and to say that we're just evolving, and this is what we now think is important, and this is why we now think it's important, and this is why I think it will help our organization. So I think that's a message you can easily develop and deliver without making it look like we made huge mistakes or we were doing it wrong all these years, because I don't think that that's true. I just think that we've evolved as a profession like most professions do.
Yeah, all right, great. Next step, probably I think at least partly following logically from the previous step about lagging and leading indicators, is taking a deep dive into data. What do you mean by that?
We all keep all kinds of data, right? We keep reports and investigations, and I mean, there's just all kinds of things out there. And whether your organization has a real fancy dashboard that you use to display it, or whether you're still doing things on Excel spreadsheets, or maybe not even as sophisticated as all that, we all have it. We have incident reports, we have near miss reports, we have inspections, training sessions, JHAs, we get loss runs from our workers' comp carriers. There's internal data like that. There's external data at BLS. National Safety Council has accident facts. NIOSH has FACE reports. And there's just a lot of stuff out there that will allow us to really take a look at our organization and begin to think about where we are and what kind of information we need to be gleaning from that. It's not just the numbers. It is what's in those numbers that we need to begin to take a closer look at. So it kind of goes back to that idea of identifying those precursors, those tasks and activities that pose the highest risk. And when we really look at our data, and we can begin to pull out that 20%, if you will, and that's where we need to begin to pay attention. We did a survey within our organization, and we looked at the past 5 years worth of incident reports, our lost time incidents and other kinds of things, because we were looking specifically for did this have the potential for a serious injury or fatality? And we ended up with about 16% of those incidents had that potential. So we were close to the 20, we were a little bit below, but we don't do a lot of really high hazard tasks here at GAI, like confined space entry or trenching and excavation. So that made sense to us. But then we said, what did we do about those particular incidents? Did we just record them and investigate them and then move on to the next one? Or did we use those incidents to make incremental systems-based changes within our organization? And so that's what I would suggest that organizations begin to do. Don't treat all data the same. Internal data and external data has the potential to provide you with the information that you need. And once you figure out where the highest risks are that are specific to your organization, now you begin to be in a position where you're better able to learn how to manage those risks through a risk management process.
Good, good. I like the idea of looking at data as opposed to just going on your gut or whatever. I had a recent conversation with someone you mentioned earlier, Ron Gant, about that word data. And he was cautious. It was kind of interesting. I used it maybe too loosely, and he was cautioning against focusing solely on data at, I think, the risk of excluding other evidence, not non-data evidence, including experience and stories. So I thought that was an interesting sideline from him, and I may be able to tease more out of him on that issue in the future. But I love the idea of using data to track that. Your last point is find a few risk champions at work. And we kind of touched on that before, but maybe you can give us a little more insight into that.
Sure. I think we all know, I mean, if I use the term safety champions, I think we all pretty much know what that means. Those are those folks in our organization that really have that passion for how they approach workplace safety. They're always willing to participate in an initiative or sit on a committee. They're always bringing good suggestions. They're not afraid to have those difficult conversations with their coworkers about something that they see them doing, and they do it in a very a concerning and coaching way. There are risk champions as well, and there's a similar, like a parallel group of people, and safety champions can also be risk champions, but they're the people who will help you approach workplace safety from a risk perspective. So you can find a professional network on LinkedIn or in conferences or your professional association, and that's great, but you need an internal network as well, because the change that you're talking about making is a pretty heavy lift, and you're not going to be able to do it by yourself. You've got to have to find people within your organization that you can count on to help carry the message and to talk about risk and to talk about the kinds of changes that are being made, and help approach that with the workforce. Because if it's just one of you or two of you or three of you and 5,000 of them, you need a team to help you with that. They may not understand risk management. I think you probably know that you can teach them that. You can help them understand those concepts because it fits into their philosophy of work and how they approach work. So I would say you've got to start looking for those folks. begin to find them and begin to work with them to get them to be your champions within the organization, so that as you begin to implement these kinds of things, you can find some people to help you do that. Some of them can be workers, line staff or frontline supervisors, but they can also be in support roles. They could be in your supply chain process, who understand the risks of certain products that they buy. They can be involved in insurance coverages, so that your organization might have a risk manager whose job it is to address an insurance perspectives. You may have some financial people who look at risk from a financial perspective. So all of those folks provide opportunities for you to create a team, if you will. And I think that's really important as you begin to move forward. So the sooner you begin to identify those folks, the better.
I like that idea of kind of creating cross-departmental learning teams on a focused topic like risk. Have you ever participated in kind of like maybe anything like that, where you have a bit of a learning infrastructure with cross-departmental teams to learn about something, maybe like a lunch and learn or something?
We do a lot of work here at my company, in the group that I work with, which is corporate support. We have 8 different directors, and it's everything from communications and human resources, health and safety, project management, and we focus on team projects, because most of the things that we do touch various parts of the organization. And so we find ourselves working together in teams of 2 or 3 or even all 8 of us on a particular enterprise initiative that touches a lot of different parts of the organization. And we all have pieces of that. There may be one person who is the manager of that particular project, but we rely on each other to help implement different kinds or different pieces of that project. So that happens a lot here. And I think that's a fairly common approach that a lot of organizations who have learned the importance of breaking down those silos have learned to approach their work product that way.
Great. My next question for you, we might have already covered. I was going to ask if you could recommend any resources, including standards, books, websites, people, where people can learn more. And I think you've kind of done that well, but does anything come to mind that we have not mentioned that you'd recommend if someone wants to make the next step and learn even more?
Yeah, I would sort of bring some of those back and sort of add to it and expand on it a little bit. I think there are 4 people whose body of work really deserves people's attention. We talked about Karsten Bush. He's a gentleman. He's got a great book out there. It's called Safety Myth 101. And takes 101 safety myths, and when you read that book, it will challenge you to think differently about all kinds of things that you think and things you hold dear. And in fact, if you look on his website, the cover of the book says, "Caution: reading this book or parts thereof may seriously harm your professional beliefs and habits." Karsten takes a really sort of a tongue-in-cheek and a little bit of an interesting approach, and he's just fun to read and listen to, and he does webinars and different things. We talked about Todd Conklin. His podcast on pre-accident investigations is based on a book, which is an excellent book, and he's got some newer stuff out on workplace fatalities. He appears in lots of places. Keep an eye out for him. Obviously, Sidney Decker, who coined the phrase "safety differently." He's got a lot of great books out there. He just revised his book on just culture, and it's on my reading list. I haven't read it yet, but it just got revised a couple of months ago. And then the last one, I think, is somebody we talked about before, which is Fred Manuel, who is a gentleman who has been a thought leader in our profession for a lot of years. Advanced Safety Management and On the Practice of Safety are great books. He's very well written and published. Then on the other side of it, I think there are some other folks that are worth paying attention to. Bruce Lyon and Georgie Popov have been doing a lot of work on risk management. And they just published a book. ASSP just published it. It's called Risk Management Tools for Safety Professionals. It's again on my reading list, but it's a really nice primer on risk management. And if you learn by reading books, it's one I highly recommend. And then if you want to go a little bit off of direct stuff, I would recommend a couple of folks. Daniel Kahneman, who wrote Thinking Fast and Slow. It just is a different way of approaching the way we do things and why we do things. Another older book by a gentleman by the name of Ian Ayres, Ayres, is called Carrots and Sticks. Both of those will kind of help wean you off of the operator error approach to incidents, and have you really begin to think differently about human behavior and why people do what they do. And I think that's fundamental to making those changes in how you approach workplace safety. Because if you approach it from the expectation that employees are the ones that are going to fix it, then that's kind of where you get off on the wrong track. And those two books, I think, will get you to, not in a direct workplace safety way, but in a sort of a side way, get you thinking about those kinds of things. So those are my recommendations.
Great. I learned two things I did not know in the past. A couple things I throw out in that group of kind of new looks at safety. I would mention Eric Hallnagel and his books.
Yes.
And you mentioned Ron Gant.
Yes.
And his safetydifferently.com website.
Yep.
For those who don't know, Kahneman is a behavioral economist. And some other things to look at on that path are the entire Freakonomics series, and also Daniel Earley, all of whom delve into why people do what they do and the decisions they make.
Yep.
Okay, so that's our discussion. What should I have asked you that I didn't, Pam?
I think you got it all, Jeff. I really don't know of anything else. I guess, the most important takeaway from this time together is really just that if you're interested in making a change in your organization, don't panic. Just, sort of think about it in bits and pieces. Find a couple things you can do right now, within the next month, that aren't going to take, you've still got to do your job while you're trying to make these changes. So it's not like you have 40 hours a week to work with. But if you can find some smaller things to get you started, you get those wheels moving in the right direction, and you get that momentum and begin to read and think. And the more you read, the more people you come up with. You gave me a couple of names here I hadn't heard of before. And it becomes sort of a spiral that gets you moving in the right direction. So I think, as a profession, as I said earlier, we have evolved. We're still evolving, and that's as it should be. And so this is an evolution that we're going through, or a revolution that you might think of we're going through. So.
All right. And if those are a whole bunch of great people to learn from, I've tipped my hat multiple times that I learned a lot from you. If people want to follow my lead and learn from you, how can they follow you? How can they connect with you? Or where should they look for you? Are you speaking at any conferences soon? Anything like that?
Sure. I am on LinkedIn, and I'm happy to connect with anybody. I'm also on Twitter. My profile is @SafetyPam. So I try to keep some things that I focus on in those two places. So that's kind of my social media. I do teach risk assessment for ASSP, and so for that particular course, I may be one of those instructors, and I'd love to have anybody who listen to these participate. We've got a session of that coming up at the end of January at something called Seminar Fest, which is ASSP's sort of seminar extravaganza. 60 different seminars, anywhere from 1 to 3 days. There's a lot of stuff there on risk, and I'll be there for a good chunk of it. That's another place that I'll be at the ASSP's Leadership Conference in October, participating in that as well. And, I'm happy to share my email. It's p.walaski@gaiconsultants.com. And I'm happy to hear from anybody.
Great. Well, that's going to wrap it up. So I'd like to, first of all, thank everybody out there who listened or read for your time. Hope you learned some great stuff, and I'm sure you did. I'd like to remind you, we're talking with Pam Walaski. She's with GAI Consultants, and I do encourage you to seek her out and in various places, publications and conferences, as you just discussed. And Pam, I'd like to thank you very much as well. Thanks so much.
All righty. Thanks, Jeff. Bye.
All right. Bye-bye.